So it's fun.
Well, and here's the thing, right? The cases at conferences that you see, especially with the All on X cases, you're going to see like the beautiful cases that had like a complication. And here's how I solved the complication. And it's usually with products of somebody who's lined their pockets with honorarium. I mean, it's just the way that it goes, right? It just is like, let's just call it what it is, folks. Go ahead, blow up my socials if you want to say that's a bunch of BS, and I'll call you out on it, right? That's what the Tooth Sleuth podcast is all about, right? Right. But let's have an honest conversation about this. And you talk about it, about being authentic and transparent, words that we love to use. Here on the Tooth Sleuth podcast, we talk about being vulnerable. This vulnerability piece, which is so critically important, because anybody who's a regular listener knows, I mean, let's talk about the white coat problem, right? Let's talk about the challenge of the stresses and pressures, and they don't have an outlet and they're not talking reality about it, the pressures of the practice and of their team members, and then what? Yeah, I mean, it's a top 5 list of suicide that we don't really want to be in the top 5 as an industry. I say we because I include myself, because I'm a contributor to it. If we're always talking about more arches and more marketing and more conversions and more and grow your team and build your practice, and so this type of environment, to be able to allow them to decompress, right, and still get education at the same time. And the education might be about learning about themselves, right? Because that's the thing. What we're finding at G&A Consult, as I build out a team and allow more team members to do the teaching, coaching, and training, and allow team members to do more of the operational side of the business and working with our clients, I get to work more with the founders and the owners on the mindset, right? About how are you leading? What are the challenges you're facing? Identifying it and saying, if you do have a lot of turnover, what are you doing for yourself
Right.
to help that situation?
Absolutely. Because most of the time we got to look in the mirror, and see how
I
we're
talk about
showing
that. Yes, yes.
and the hard thing for dentists in all of this is, in dental school, you learn very little about business, you learn very little about leadership, and you learn very little about communication. For most of it, it's either trial and error, or we find great mentors. If we find great mentors early on, well, then again, it's all about fast tracking. I want to shorten that learning curve so that I can be successful more quickly. And I did that. I sought them out. And to your point earlier about, sometimes when you're in a small group setting, being really real and getting the actual scoop on what's up. I used to, even at a big conference, and not many people do this, but I would seek those people out, either try to take them out to dinner or for a drink. And I always used to say I learned more between 9 p.m. and 3 a.m. than I did in an 8-hour lecture. And the luxury dental retreats are set up similarly. We'll have 6 hours of kind of conversational education where we can dive deep on whatever their situation is, whether we're talking about implants or cosmetic dentistry or clear aligner therapy or leadership communication or practice transitions. We can roll up our sleeves and really do that. Because at the end of the day, one of the biggest problems dentists have is just feeling overwhelmed, feeling burnt out, and they just don't know what to do about it. And they've lost all semblance of life balance. And, you mentioned the suicide rate. I got to share that my first day at dental school, 33 years ago almost now, but they said dentistry had the highest substance abuse, highest divorce, and highest suicide rates of any profession. And Greg, I was stunned. It's like, oh my God, what did I get myself into and why? I couldn't understand it. Almost all the way up until I got out into practice and realized, wow, I don't necessarily have all these skill sets that I need to be successful. How can I find those? And again, it was all about mentorship and trying to be in the right room with the right people.
Well, and thank you for pointing that out as well, right? The other piece is not just the suicide rate, but the divorce and the substance abuse. And being in recovery 20 years myself, I'm super diligent and mindful of that at all times. And if anybody who's listening, wants to have a conversation, please reach out. My friends Margie Schaller and Laura Nelson at Sober Life Rocks, to be able to create a
Yes.
platform
What a
and
great,
normalize
yes.
sober options at these dental
Oh my gosh.
conferences.